webinar. So I'll do a bit more of the formal introduction. I'd like to introduce you all to Dr. Shannon Scratch, who is a clinical scientist at Holland Bloorview Kids Rehabilitation Hospital and an assistant professor in the Department of Pediatrics and the Rehabilitation Sciences Institute at the University of Toronto. She's a practicing clinical neuropsychologist, and her emerging research program and hospital clinic are dedicated to youth experiencing prolonged symptoms post-concussion and acquired brain injury and their caregivers and families. She was recently appointed to the Holland Family Professorship in Acquired Brain Injury, and she is passionate about fostering youth and family engagement in research and is the co-chair of the Research Family Engagement Committee at Holland Bloorview. I'd also like to introduce you all to Alex Alcater. Alex is a longtime colleague of ours here at the center and me personally. He's Senior Director of Planning and Research at Kinark Child and Family Services. He's worked in the applied research mental health sector at both the provincial and community levels and leads a team of research, decision support, quality, and policy professionals to promote evidence-based practices and data-informed decision-making at Kinark. And last but not least, Marie Hooper is a senior doctoral student in the Clinical Developmental Psychology program at York University. With funding from MHRC and our center, Marie's doctoral research is adapting and delivering the first mental health virtual intervention for siblings of children with special needs. She's currently a clinical research project manager at the Hospital for Sick Children and a psychoeducational consultant for the York Region District School Board. So welcome to you all, and I will turn it back over to my colleagues at MHRC to get us going.
Great, thank you so very much. We're really looking forward to this today. I just have a couple of housekeeping items. First of all, our speakers will present for about 25 minutes or thereabouts. And we do encourage you through their presentation to enter questions as they come up so that we can try and manage those. And we will try to do our best to get as many questions answered as possible. We are going to turn our videos off so that you can focus on our presenters. And I just wanted to note that as you can see on your screen, we are recording this session because we do want to make it available to people that are not able to join us today. So I just wanted to point that out for everybody and acknowledge that. So over to our presentation today. Thank you so much for being here. Oh, we can't hear you, Shannon.
Yeah, can you guys see this a little bit? I'm going to get this going here. Hopefully my internet participates. Everybody see?
Yes.
Wonderful. So thank you again for having us. We're going to be chatting about our virtual intervention for siblings. If you see me look over here, I've got a dual screen. I'm not looking away from you. And like everybody was saying, this is lots of people have been on board to help this research get started. I like to put my thank yous at the beginning. I think they're too important to wait for the end. So I'm not going to go into everybody's name here, but just we have a beautiful team for the iSibWorks project. So I'd like to thank them and specifically acknowledge Kate Strom, who created the SibWorks program. And you're going to hear more about that later on. Also, we have some beautiful sibling participants and their parents, and they gave us time when it's a short supply at the moment. Everybody's feeling really under the pump with the pandemic. So we really thank you for dedicating your time. And lastly, to the funders, to Mental Health Research Canada and Ontario Centre of Excellence, thank you for recognizing the need and also for believing in me as an early career researcher. It's a really meaningful thing to have backing of such beautiful organizations. So thank you so much. I'm going to hand it over to Marie because not only does she have that stunning bio, she's actually a beautiful family leader as well. And she wants to just kind of walk through her story and the rationale for why we started this project.
Hi, everyone. I really started my journey. These are the most important people in my life, sort of in this photo. One is my daughter, Sloan. She's on the left bottom of the picture here. My son, Sloan is going to be 8 next month, sassy as they come. She is really like a firecracker and currently doing hip hop and guitar lessons and horseback riding, which she loves to do. Only the cheap sports. And then my son there, that's Ashton. He was about 3 years old in this photo, but he is going to be 6 in February. Loves all things Alvin and the Chipmunks, Emma, and guitars. And that's my husband, Charles. I feel like this picture, looking at this, has been, feels like it was 20 years ago when this was taken. As a graduate student and as a parent, obviously I was trying to balance a lot of things going through this program, and I knew that I wanted my dissertation to be meaningful. I started grad school, my daughter was about 2 and my son was just born, and we were hit with a catastrophic diagnosis that my son probably wouldn't make it to his first birthday. That meant that bringing him to OT and medical appointments at Sick Kids and physio and all of the things. And while all the focus was on my son, of course, and understandably, often my daughter was kind of dragged along to these meetings and, hospital visits and, being shoved off to grandma's house just so, we could stay in the hospital for undetermined lengths of time. And, we got involved at Sick Kids, and we're part of this Versus campaign. And this was the original photo that was taken. And I'll just, Shannon, if you don't mind, just switching to the next slide, that would be great. And this was the one that was edited. This is the photo that ended up making their campaign, which we absolutely love this photo. And we truly, Sick Kids is an amazing place. But this is exactly why I wanted to do this research. My daughter was left in the waiting room. She was cut out of this photo, left in the waiting room. And really, when we needed mental health services for our older daughter who was going through her own stuff, while we were so focused on the health of my son, there really wasn't anything. And so this was the impetus for wanting to do this project.
And, I think the literature really jumps on what Marie's saying there as far as need. And we know in Ontario alone, 1 in 9 children are living with a disability, and many of those have at least one sibling. We know that's well documented that the sibling relationship is one of the longest ones that an individual has across their lifetime. And we also know that siblings of children with disabilities, and we're just going to call them siblings from here on out, are at an increased risk for mental health challenges. That's including social, emotional, behavioral challenges. Most of the current literature on family members focuses on the parents of the child with disabilities, and the studies on siblings are lacking, and unfortunately, care for siblings is even more sparse. So what do we know about sibling interventions? And like I mentioned before, siblings are at high risk for mental health concerns, but we know that some support programs are effective in offering siblings social and emotional support that they can learn through educational activities, can help children to build resilience and positive relationships. And in order to really look at what makes these interventions so successful, our team started a scoping review. So that's a really detailed look at the literature. And I wanted to highlight some of the primary findings from this because I think it's really important for what we're going to be chatting about in a minute. So what do we know about these sibling interventions? We just pulled about 31 studies in the end, and there's a big process to get to that. But some of the analysis is showing that there's been 4 important therapeutic elements that were identified to show that interventions really work for siblings. And they're important to ensuring that the intervention can kind of help and target some of the challenges they're experiencing. And those elements are information provision, so that's through education. Also having a safe space for peer support where you feel like you understand and other people understand your experiences. Some of these sessions need to have some targets. They need to have behavioral skills and teach you things. And those interventions that do that have better efficacy. And also things to take away so you can remind and review later on. Even for kids, this is really important. So when we did a review, it's really showing us that readily accessible interventions, like those potentially facilitated virtually, should be made available to improve sibling health and convenience for families.
And one of these interventions is the SibWorks program. And so this program is traditionally offered in person. It began in Australia for 6 weeks. It's a group-based program, and it was run primarily in a community setting in Australia. And SibWorks aims to enhance social networks, improve relationships between family members, and increase resilience. A small randomized controlled trial was conducted in 2015 and showed that SibWorks meets its aims. It also found that siblings from families where the child has a very severe medical complexity or disability, like my own, had the greatest intervention improvements after completing the program. The adaptive program, or the adapted iSibWorks program, as we're calling it, will be delivered online across 6 weekly sessions. And we've started doing this already. Each session covers a set specific theme, like exploring individual differences, problem solving, coping, and includes a mix of physical activity and reflective exercises. SibWorks is centered around 4 primary values. 1 is the whole family approach. 2 is family-centered care. 3 is the prevention and early intervention. And 4 is peer support. While the adaptive program continues to carry on all of these values that were embedded in the first sort of iteration, iSibWorks aims to add a 5th value, access, emphasizing that this adaptation will be more readily available for siblings in need. And how are we doing this? We're doing this through virtual care. We are adapting the program for smaller groups linked together by age and grade, and adapting some activities to better suit the virtual environment.
So in the adaptation study, we hope to address the mental health needs of siblings, and we know that they're frequently missed in our care system. They fly under the radar of diagnosis and detection, so we really want to give them a space here. And our overall goal is to use a video conferencing platform. So we're going to be using Zoom, just like everybody's upskilled in now, to adapt a validated program, to adapt SibWorks for virtual delivery. And so how are we doing this? And we've already made a start. But we've kind of done 3 main things. We consulted with a stakeholder group, and that's parents, siblings, clinicians, community care providers, and they reviewed the program and suggested some adaptations for the activities for online. We did some feasibility testing. So that means we tried the intervention with a small group of siblings, asked them how it went, if any improvements could be made. We interviewed them to understand their experiences with the intervention. And once we're finished making tweaks to the program based on some of that feedback, we're ready to get started on a larger pilot. And we've just kind of gotten this going a little bit, but the groups in this pilot are bigger. They're about 6 siblings per group. And we're running more of them in order to look at any changes they might be experiencing before or after the intervention. So since this pilot's still ongoing and we're collecting some data for it, we're going to focus the rest of this talk on some preliminary findings from the feasibility testing.
So we completed 2 feasibility groups, and our study objectives were to explore the accessibility and feasibility of the program and to explore whether siblings felt comfortable sharing their personal experiences in the group setting online. And we had some specific questions for this study, like are participants able to use and effectively navigate iSibWorks after 2 years of a pandemic? The answer is absolutely. Are participants satisfied with the virtual intervention in online format? What modifications or suggestions do participants have that will improve iSibWorks for the pilot study? Our next slide talks about sort of the pre-post design. We have exit interviews and questionnaires. All of our weekly sort of sessions are here, getting to know each other. We really spend some time doing some rapport building. We talk about differences and some of the things that are the same between us. Then we get into emotions, and then we get into problem solving and coping. What kind of things can kids do to help themselves when they're feeling stressed out? And then week 6 is really tying it all together and leaving stronger and knowing that there is support and resources available. So one of the things that we really, I couldn't wait to get this data back, but we interviewed the youth sibling participants after they finished the iSibWorks program. And so I just want to give you some examples of some of the participants' experiences with sharing as part of a group. So I like that there were different people that I didn't meet, and I made friends with them. This was an 8-year-old girl. Yeah, it was like kind of more comforting. There is like other people there who like know how you feel, and so it's better. I thought the program was fun and cool, and I got to meet other kids who have a sibling like I do. Just in running the groups myself, when they're all meeting for the first time and they're talking about themselves and their siblings, the look on their face, it's like, hey, like you're like me, like we have a lot of similarities. They think that's pretty neat. As you can see, the sibling participants really enjoyed being part of the group with shared experiences and felt that they made friends with people who understood their experiences and world. Even, in spite of, the Zoom setting, they were able to make friendships. We also wanted to understand their experiences with the program and its features. The activities we got to do were pretty fun. There are other people who are kind of like me, and that was also pretty cool. I honestly liked it, and the first time I've done something like that online, and that was a 12-year-old girl. I like it because this program can help other people like deal with different things that they didn't know how to deal with before. And that was an 11-year-old girl. And it's kind of it's like a kind of stress relieving Zoom call. That's an 11-year-old boy. And the siblings enjoyed the program features and components, and they liked coming back each week. They did offer some minor changes to activity formatting to help for the future trial, but nothing significant changed after these interviews, which is pretty great. Parents know their child best, and we wanted to really understand what parents saw when their child participated in this program. Parents also offered us some minor activity changes to improve the virtual program adaptation. So in general, they appreciated the program and would recommend it to others. They love the games. They liked, being able to talk to other kids. So we had a child that had her kids in 2 different groups with one of the children, one of her 3 had special needs. So I got to sort of meet both of them in different groups in different settings. I really like that I could tell from his responses that he really did enjoy it and that he was sad that it was ending. And that was a mother of an 11-year-old boy. The program seemed to be interactive with a lot of back and forth rather than just listening to strategies. And I think that was good. And that was a mother of 2 girls, ages 8 to 12. And I think that was the key, or one of the key things about the program is really making this interactive after a long year in COVID lockdown. So we needed to have that.
So we know that quotes are a very powerful way to show the experiences of participants and make sure that their voices are heard in the research that we do. And we're almost finished with detailed content analysis, but overall, we found that the iSibWorks adaptation so far is feasible and enjoyable. And you're not going to get any changes, any efficacy changes if people aren't engaged with the work you do. Siblings, they felt comfortable sharing information in a virtual setting. And no surprise here, they were able to navigate the video conferencing tech really independently. And I guess thanks to the pandemic for that. So what are we doing now? Now we're testing the program's efficacy. So that means, does it actually promote change? Does it actually work? It's one thing to really like it, to be engaged with it, but we want to make sure that we're showing some changes and that it's really hitting the mark for some of these kids. And we'll have some results for this hopefully mid next year. Pilots are ongoing at the moment. As far as broader next steps for what we're doing as the iSibs team, like I said, the pilot's going on, and that's for 8 to 12-year-olds. We're also realized that 6 to 7-year-olds, these young kids, need some support too. So we're starting iSibs Junior, and that's an adaptation for younger kids. And we've gone through 1 round of testing for this, but we have to do things like tweak the length of the program and some of the activities, and we'll be iterating through to make sure we get feedback before we really look at pilot there. And the other one is iSibs Teen. And so this is obviously coming up as a huge need, and teens have their own kind of set of challenges and developmental needs. SibWorks originally wasn't designed for teenagers, so we are building it with the blessing and support of the SibWorks original team. And so hopefully we'll have some of that program details out soon as well. So this is a very active study at the moment. And as you can imagine, needs from families keep popping up, and advocacy from beautiful parents for their children keep coming up. And we're trying to integrate it into the research framework as much as we can. If you're listening in and you want to know if you can join, for sure, we'd definitely love to chat to you about that opportunity. And you can contact Hiba, who's our just spectacular project coordinator managing all of this. So please give her an email if it's something that interests you, or if you have any follow-up questions as well. So again, thank you to everybody who's on the call. Happy to take any questions, and thanks so much for listening to our talk.
You're on mute, Akila.
We all get caught in that now and again, don't we? Wow, what a heartwarming presentation. That was lovely. This is very important work. And Marie, probably first question on everyone's mind is, how's your son?
He's amazing. He's almost 6, and he attends Holland Bloorview's integrated education therapy program in kindergarten at Holland Bloorview. And he, this morning told me that he didn't want to wear his boots. And so I got scolded this morning, but he's the happiest kiddo you could ever imagine. And we were just granted our Make-A-Wish trip. So we're really excited to be going to Disney this year.
Oh my goodness, that's very exciting. Wow. Very, very glad to hear that.
Thanks for asking. Yeah, no, he's great. Everyone's fabulous.
Good. Someone is asking, could you put Heba's contact in the chat, please? I guess there's some interested folks to get in touch with her. If we could put that in the chat, that would be great. Question, has any early feedback from families led to changes in the program delivery or research study? And if so, what does that mean for future participants?
Yeah, I can jump in, and then Marie, you can jump in too, because you see them and work with them through the program delivery. I think it's really important. Like we said, we're very passionate about making sure that families are involved and integrated. And there was definitely feedback that has led to changes. And I'm so thankful that we did this, and we're supported through both the agencies to take this step first to really make sure it's feasible and really make sure it's achievable. A lot of funding organizations don't allow you to do that. You jump right into the pilot and you don't check in with families. And I think we're going to have better results and better efficacy because of this. So some things have just been changing some of the activities so that they were a little bit more engaging in the setting. For the younger kids, it's actually making it a bit shorter. Marie, were there other kind of big ones that you noticed too? I don't want to take up all the space. You've been so involved in the study.
No, you hit on the big ones. I think, yeah, the younger they are, the more they need to move, which wasn't in our original sort of plan. So I've duly noted for the next rounds.
Yeah, and I think it's going to be really important when we're building out the teams, right? No one has done this before for teens with a cognitive behavioral therapy framework using those psychology principles. So if we don't ask teens what they want to learn about, what they want to hear, what skills they want, uptake is not going to be there. So it's important to have these support groups, but it's also important for it to be meaningful. So that's the work we're engaging in with the teams, and it will frame up what we deliver. Yeah.
Wonderful. I'll ask one more question and then see if Sarah or Purnima have any other questions. We will make sure you get Heba's contact information. In fact, Sarah maybe can email that afterwards so that folks have it beyond the call itself. My question is around the program for teenagers that was up on one of the slides. Wondering if you could tell us a little bit more about that, what that might look like. I'm not sure if you've fleshed that out yet, and what that could mean for families.
Yeah, so we're lucky at Bloorview because we have an evidence to care team. So they're knowledge translation specialists. And within my lab broadly, we have a knowledge translation specialist that works with us. So it's just been a different group to work with because they make you stop at the beginning, really consider the people you're working with, and build the needs that way. So what we're doing is doing that discovery work, seeing what needs to be changed in the program, and we'll be onboarding different families that way. We've had a lot of interest from teens to be part of this. I think it escalated a little bit more while we were at home for so long as well, the needs there. So I do think that hopefully we'll be having some feasibility trials mid to late next year. And I think, Alex, you see at your organization that there are a lot of teens in needs as well. So hopefully we'll address some of that stuff.
Alex, why don't you tell us a little bit about KinArc?
Sure, I'd be happy to. And I guess I have a question from an observation from KinArc. So it just maybe from, before we were coming here today, I reached out a little bit and I wanted to hear how some of our providers felt about this service. And I can't overstate how happy they were to have somewhere they could refer a sibling of some of the clients we serve. They recognize this gap that, the same way that it's been so beautiful is the wrong word, but it's beautifully explained today. And I guess I wondered, have you guys heard some of that kind of feedback also from the families or from the service providers who've connected with you? And I'm just wondering what your thoughts are there. And I'd be happy to tell you a little bit about KinArc and why we wanted to engage and partner in this work certainly as well.
Yeah, I think that service providers also want, not only do they want to know there's something there, they want to know that it's something that's quality that's there. I think people are always nervous sending people to something that they don't know if it has been studied or it has been looked at, and we can actually say definitively this is hitting the need. And I think that we're able to do that. And this just shows that really nice integration we have between clinical care and research at Bloorview. So I'm in clinic, I'm there with families all the time, and being able to jump in and out and offer a clinical adjunct through a research mechanism is just really exciting. And I think that we have gotten good feedback from people that have been referring in, but a lot of them have been from CNARC as well. So I think we might be hearing from the same people.
Great. To our audience, don't forget to put questions in the chat. Don't see any. I always have lots of questions. I can keep asking questions, but Purnima or Sarah, my colleagues, I don't know if you have any questions.
Well, I can jump in. Alex, you stole my question. My question was going to be, so what are the people that are delivering care to the sort of the sibling? How are they finding the program? And so it's really nice to see that it's actually solving one of the challenges that they confront, which is how do you provide holistic support to the family, right? I guess, you know, Shannon and Marie and Alex, if you had, and I know, you know, there are tons and tons and tons of questions that researchers have. If you had funding and if you had kind of unlimited funding, what's the next question that you would want to ask in this area, building upon the findings that you've generated just recently?
Yeah, and you know, I actually know exactly what it would be, because we've had these amazing parents advocating for their kids, and you know, let us see even more system gaps and more gaps that we didn't even realize were there. I think when we designed the study, we thought it was really inclusive. Like, look at all the support we're going to be providing to families and researching at the same time. And little did we realize that even our inclusion criteria was excluding people, because it was so rigid around the idea that the siblings that are there have to, you know, can't have a diagnosis themselves or any of these other kind of things. It was very much a healthcare driven way to ask that question, instead of the family saying, this is the sibling that's in need. And so families have been just amazing advocates to say, wait, my one son does have ASD, but my other son has ADHD, and that son needs some support.
Right.
And they didn't make it into our criteria. So getting phone calls and hearing made us really realize we need to look at this too. So we have a feasibility study starting with this group. So how do we kind of allow those kids that are in between access these supports, and does this intervention work for them? So it's been a bit of a hustle project on the side. Things always do this in intervention work, right? And that's what we need. We need that flexible base of a program, but we need to know that it works for everybody. And how do you form your group so that it's appropriate and people can share appropriately? So those are the kind of questions that I know I would like to ask, to make sure that you never want to hear that you think you're doing this great study and then people are like, but you're still missing me. So hopefully we can be inclusive in that way.
So we have a question from the group. Can you speak to the differences between Sib shops and Sib works?
Yeah, so I had actually was just typing an answer there as you brought it up. So Sib Shops is a beautiful program by John Mayer. It's an international program that has had a lot of attraction because it's kind of the only one of its kind. It's a peer support group, and it's much less led by a clinician in the way that SibWorks is. SibWorks is based on sort of the CBT principles, evidence-based principles, whereas Sib Shops has less of a clinician involvement. So a little bit different in that way.
Yeah, I think they complement each other, right? There's space for a support group, and there's space for a group like ours, which is a little bit more skill-driven, discussing kind of emotions and feelings.
Oh, we lost your audio, Shannon.
Oh, can't hear you, Shannon.
Halfway through that sentence. Shannon, say something.
Hello? Am I gone?
Oh, we got you back. We got you back.
Sorry, I don't know if you heard, that's Zoom. You just start talking over yourself. I was just saying they complement each other, those two programs, and you know, they don't exclude people from being in one. Peer support groups are so important, but also skills-based training around emotion and behavior is really important too. So I think they work nicely together.
And what would you envision for this work 5 years out if it proves to be a solution that works? What do you envision? What do you hope for?
Do you want me to take that? Well, I'll start, and then maybe Alice has visions too for community. But as a hospital, I see like a hub and spoke type model works really well with this. Because it's virtual care, we can offer this this intervention to people beyond the walls of Bloorview quite easily. So if we can employ a clinician to run these groups and not be a job, we would actually have a massive reach with one clinician FTE, considering that there's nothing right now. So that reach would just be massive, and then grow from there to serve different partner organizations. What about you, Alex?
No, I think, no, absolutely. I mean, like having this kind of a service available, as a core piece of the services we're seeing available through communities is amazing. And that's the kind of thing I'd love to see is a place where we might be in a number of years. And I'd love to see that the work from this kind of service is connected sort of directly maybe to some of the how possible, that's a different question, maybe to the work that's going on with the other sibling there, and I'd like to sort of see how this sort of helps to drive that whole family approach to service and to care that is certainly missed in some part in the way that our services are structured and set up right now.
Wonderful. I don't think we have any more questions. I want to take just a moment before thanking all of you to share that in partnership with the center, we're currently open right now, accepting application for 5 postdoc fellowships to the tune of $60,000 each. It's only for Ontario. To those of you that are outside of Ontario, on our website, we have many other opportunities beyond Ontario, but this is a really exciting one. And we've been working closely with the center on this, and we're very, very excited about it. So there's more information on our website, on the center's website, and we're currently open for applications, and we close end of October, Sarah?
October 31st.
October 31st. So if you know anyone in Ontario who might be interested in applying, we would love to get applications, and we're so very excited to be awarding those fellowships up and coming. Purnima, did you have any last words or closing words or any final questions?
Yeah, no, I want to just thank you, Shannon, for acknowledging the importance of supporting early career researchers and even students. So I think that, one of the things that is helpful in our endeavors to close the research practice gap is to get people early on in their careers to start thinking that way. And so, with our partnership with MHRC, which has been so fruitful over the last several years, we thought, it's really, really important to support academics and people who are in the work world right now, but really to get people at the very early stages of their career and sensitize them to the importance and or support those who are already sensitized to these ideas of applied research that is really intended to shape practice in a very engaged and applied kind of way. So really, really important. Glad it's going to obviously it's going to such good use with you folks, and really excited to have heard how your project is evolving, and excited to support your next steps over time.
And goodness knows, with this pandemic and the mental health needs, there's never been a more important time for mental health in Canada, and to build a pipeline of researchers. Sadly, we're going to need it, but hopefully we can use this moment in time to work together across the country and build back better, as they say, and make sure that we can get mental health work supports into every workplace, and that we can increase accessibility and evidence-based availability of evidence-based resources. So very, very exciting to hear about your work, and we look forward to having you back down the road to hear your results, and happy to help in any way in terms of knowledge sharing when you get your results, and to hopefully pave the way somehow for you to have that dream come true, where this is expanded and maybe you have a clinician leading this with a spoken hub model. That sounds very exciting. So thank you all for taking time out of your very, very busy schedules today. a very special thank you to my colleague Sarah, who does a tremendous job managing all of our grants and activities and studentships and partnerships associated. She's very busy and she does a great job. So thank you, Sarah. She's quietly in the background today, but she's very much in the forefront leading the charge here. So thank you. And if anybody listening has any additional questions, I'm sure that Shannon Marie or Alex would be happy to answer those by way of email, and we can certainly make those connections because we're very interested in connecting resources, people, researchers, information. That's what it's all about. And lastly, very, very big thank you to our friends at the Center of Excellence and Purnima Sundar. Thank you so much for your continued support and partnership. We very much appreciate working with you, and it's an absolute delight and pleasure. So I hope everybody stays safe. Have a meaningful, peaceful, quiet, reflective day tomorrow in this important week. And thank you all for joining us today.